Hypertension, also known as high blood pressure, is a common condition that affects millions of people worldwide. It is a condition where the force of the blood pushing against the artery walls is consistently too high, which can increase the risk of various health problems, including heart disease and stroke. In this video, we will discuss what hypertension is, what causes it, what are its symptoms, and how it can be prevented and managed. If you stay with us till the end, you'll also learn about some simple yet powerful tips to prevent hypertension from occurring in the first place. So make sure to watch until then. Let's start by understanding what hypertension is. Hypertension is a condition in which the blood pressure is higher than normal for a prolonged period of time. Blood pressure is measured using two numbers in a reading. The top number, known as systolic pressure, represents the pressure in the arteries when your heart beats and pumps out blood. The bottom number, known as diastolic pressure, represents the pressure in the arteries when your heart is at rest between beats. A normal blood pressure reading is considered to be less than 120/80 millimeters of mercury, mmHg. And hypertension is diagnosed when the blood pressure is consistently higher than this level. It's important to note that hypertension is often referred to as the silent killer because it may not cause any noticeable symptoms. This means that many people who have hypertension are not aware of it, and it can go undetected for years. Regular blood pressure checks are essential to identify hypertension, even in the absence of symptoms. Now let's talk about the causes of hypertension. In many cases, the underlying cause of hypertension is unknown, and it may be due to a combination of genetic and environmental factors. However, there are several risk factors that can contribute to the development of hypertension, including a family history of hypertension, age, obesity, physical inactivity, stress, and smoking. Other conditions such as kidney disease, thyroid disorders, and sleep apnea can also cause or worsen hypertension. Now let's discuss the symptoms of hypertension. As mentioned earlier, hypertension is often asymptomatic, meaning it does not cause any noticeable symptoms. However, when blood pressure becomes very high, it can cause symptoms such as headaches, dizziness, shortness of breath, and nosebleeds. In severe cases, hypertension can cause chest pain, palpitations, and vision problems. It is important to seek medical attention if you experience these symptoms, as they could be signs of a serious underlying issue. Now let's talk about the complications of hypertension. Prolonged periods of high blood pressure can damage the walls of arteries, making them more likely to develop plaque, which can lead to heart disease and stroke. Hypertension can also damage other organs, such as the kidneys and eyes, and it has been linked to cognitive decline and dementia. People with hypertension are also at increased risk of developing other conditions such as diabetes and metabolic syndrome. Now that we know about the causes, symptoms, and complications of hypertension, let's talk about how to prevent it. One of the best ways to prevent hypertension is to maintain a healthy lifestyle. This includes eating a balanced diet rich in fruits, vegetables, and whole grains, engaging in regular physical activity, maintaining a healthy weight, and avoiding tobacco products. Managing stress through techniques such as yoga, meditation, or deep breathing exercises can also be helpful. Getting enough sleep and limiting alcohol consumption are also important factors in preventing hypertension. Another way to prevent hypertension is to monitor your blood pressure regularly, especially if you have risk factors for the condition. Early detection and management of hypertension can help prevent complications and keep your blood pressure under control. If you do have hypertension, your doctor may recommend medication to help lower your blood pressure. It is important to follow your doctor's instructions and take your medication as prescribed. Now let's move on to our main topic, the lab tests used to diagnose hypertension. When you visit your doctor with concerns about hypertension, they will likely perform several lab tests to evaluate your overall health and determine the best course of action. These tests may include a complete blood count, also known as CBC, to check for signs of anemia or other blood disorders. A lipid panel to measure levels of cholesterol and other fats in the blood, which can indicate the risk of heart disease. a fasting blood sugar test to check for signs of diabetes or prediabetes, which are conditions that can contribute to hypertension. A comprehensive metabolic panel, also known as CMP, to assess kidney function and check for signs of liver disease or other metabolic disorders. A urine analysis to detect any abnormalities in the urine that may indicate kidney disease or other underlying conditions. An electrocardiogram, also known as an ECG or EKG, to evaluate the heart's rhythm and structure and look for signs of heart disease. A chest X-ray to visualize the heart and lungs and check for any abnormalities. A 24-hour ambulatory blood pressure monitoring, also known as ABPM, to continuously monitor blood pressure over a 24-hour period and provide a more detailed picture of your blood pressure patterns. Each of these tests plays an important role in diagnosing hypertension and developing an effective treatment plan. By working closely with your healthcare team and following their recommendations, you can take the necessary steps to manage your condition and reduce your risk of complications. We've come to the end of our video on hypertension. We hope you found this information helpful and informative. To prevent hypertension from happening in the first place, here are some simple yet powerful tips to consider. Tip number 1, eat a diet rich in fruits, vegetables, and whole grains. These foods are packed with essential nutrients and fiber, which helps to maintain healthy blood pressure levels. Tip 2. Limit your intake of sodium and processed foods. Excess sodium can cause the body to retain water and increase blood volume, leading to high blood pressure. Processed foods often contain high levels of sodium, so it's important to read labels and choose fresh, unprocessed options whenever possible. Tip 3. Exercise regularly. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Exercise can help improve blood flow, strengthen the heart muscle, and lower blood pressure. Tip number 4, maintain a healthy weight. If you are overweight or obese, losing even a small amount of weight can have a significant impact on your blood pressure. Tip number 5, quit smoking and avoid tobacco products. Smoking damages blood vessels and makes it harder for the heart to pump blood, leading to high blood pressure. Quitting smoking is one of the best things you can do for your overall health and well-being. Tip number 6, manage stress through relaxation techniques such as deep breathing, yoga, or meditation. Chronic stress can contribute to high blood pressure, so it's important to find healthy ways to manage stress and promote relaxation. Tip number 7, get enough sleep. Aim for 7 to 9 hours of quality sleep per night. Sleep deprivation can raise blood pressure, so it's important to prioritize sleep and establish a consistent sleep schedule. Tip number 8, limit alcohol consumption. Excessive alcohol consumption can raise blood pressure, so it's important to drink in moderation and be aware of your daily alcohol intake. Tip number 9, consult your doctor about herbal supplements. Some herbal supplements, such as garlic, turmeric, and ginkgo biloba, have been shown to have blood pressure lowering effects. Consult your doctor before taking any new supplements to ensure they are safe and appropriate for you. Tip number 10, educate yourself about hypertension and follow your treatment plan. Knowledge is power when it comes to managing hypertension. Educate yourself about the condition and work closely with your healthcare team to follow your treatment plan, which may include medication, lifestyle changes, or both. By following these simple yet powerful tips, you can take proactive steps to prevent hypertension and maintain healthy blood pressure levels. Remember, small changes can make a big difference in your overall health and well-being. Thank you for watching our video on hypertension. If you found it informative and helpful, please give it a like and share it with your friends and family. Don't forget to subscribe for more health-related videos. Stay healthy and take care.